At a colorful launching ceremony which was held at the school's auditorium, was duly represented by Mrs. Perpetual Oforiampofo, President of the Ghana Registered Nurses and Midwife Association, Mrs. Anita Yolson, Chairperson for Critical Care Nurses Group, Dr. Benis Adam, CEO of the Kolebu Teaching Hospital, present student, among others. The anniversary is under the theme, Delivering Holistic Healthcare to Every Ghanaian and Beyond. The role of the perioperative and critical care nurse, principal of the school, Mrs. Faustina Excel Adipa, delivering the keynote address, said medical practitioners are now identified to treat and manage a variety of health conditions. The reason they need to move healthcare to adopt a more humanistic approach.
There's advancement in modern medicine for this past century. Medical professionals can now identify, treat, and manage a wide variety of health conditions. Thanks to new developments, non-invasive therapies, medication, and effective health promotion and disease prevention initiatives are now the order of the day. Nevertheless, healthcare systems have arrived at a significant reflection moment. The burden of disease is shifting from the infectious diseases that we used to treat towards chronic ones, which is causing changes in pattern and sequence of population around the world. Now we have more of diabetes, heart diseases, and other things. So the paradigm is shifting. And this is the reason why we need to move healthcare to adopt more humanistic and holistic approach to healthcare delivery.
Mrs. Perpetual Oforiampofo, President of the Ghana Registered Nurses and Midwifery Association, also said GRNMA is guided by their 5-year strategic plan, which is under the 5 main thematic areas, not to project Ghana Registered Nurses and Midwifery Association, but to project the nurses as professionals.
We are still guided by our 5-year strategic plan, which is under the 6 main thematic areas, that is leadership and governance, education and training, welfare of all members, influencing policy, communications and campaigns, and of course research. And we are doing all this to ensure that we don't only project GRNMA, but we project you as the professionals, and we project the profession in Ghana and abroad. The choice of coming to the perioperative and critical care nursing school is very important and is much appreciated. And the role of perioperative nurses and critical care nurses has been espoused by the chairperson and as the keynote speaker for this occasion cannot be underestimated. Your work as you do as perioperative nurses, taking care of the patient before, during, and after surgery is very, very important. We are coming to a point where, Ghanaians are becoming very enlightened, and they are realizing that they have the patient charter, they have their rights. And if you abuse their rights, they have every right to take you on. We need a stakeholders discussion where we all sit at the table to discuss the education of nurses and midwives in Ghana. The confusion is becoming too much, and we need to streamline things. And I was telling your principal that come September, God willing, in our council meeting, we'll have all the specialized societies under the GRNMA, and we'll discuss those issues extensively. So as a matter of agency, even if we have to sponsor it, call for a stakeholders discussion at a neutral place and sit down and discuss this. We've talked about a number of things. We say it on all platforms that we have, but it seems as if it's falling on deaf ears. And, when we have to invest in nursing and midwifery, the programs that you are doing are one of those that we need to invest in because we don't have enough of you.
She later donated an amount of 10,000 Ghana cedis to the school.
10,000 cedi check for you.
And we are so much grateful. And this is from the School of Perioperative and Critical Care. Now we appreciate you, Madam Professor, and I wish you all the best.